Have you ever applied castor oil to your skin, hoping for a youthful glow, only to end up with irritation, dark spots, or even permanent damage? If you're a senior using castor oil, you might be making dangerous mistakes that could harm your delicate, mature skin without even realizing it. In this video, we're revealing the 5 critical errors seniors make with castor oil, including one shocking mistake that dermatologists see in their offices every week, causing irreversible skin damage. You need to watch until the end because we'll also share the safe, effective ways to use castor oil that work for aging skin, helping you avoid costly skin disasters and achieve the healthy, radiant results you're seeking. Before we begin, I would appreciate it if you like this video, you can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Mistake 1. Using pure castor oil directly on facial skin. The application of undiluted castor oil directly to facial skin is one of the most detrimental skincare mistakes, especially for seniors whose skin has undergone significant changes due to aging. As skin matures, particularly after age 60, it becomes thinner, more fragile, and less capable of maintaining its natural protective barriers. Research from Harvard Medical School's Department of Dermatology indicates that pure castor oil can severely disrupt the skin's lipid barrier in older adults, exacerbating the natural decline in protective epidermal layers caused by reduced collagen synthesis, diminished elastin production, and lower sebum output. The thick, viscous texture of pure castor oil is far too heavy for the delicate facial skin of seniors, which struggles to process such dense substances. Unlike the more resilient skin of younger individuals, mature skin requires gentle, lightweight treatments tailored to its unique needs. Applying undiluted castor oil violates this fundamental principle of senior skincare, setting the stage for significant and potentially long-lasting damage. The molecular structure of castor oil, predominantly composed of ricinoleic acid, a monounsaturated fatty acid, poses specific challenges for aging skin. Its high viscosity and large molecular size make it difficult for mature skin to absorb effectively, causing the oil to remain on the skin's surface rather than penetrating deeper layers. This leads to clogged pores and the formation of an occlusive layer that traps bacteria, dead skin cells, environmental pollutants, and other debris against the skin. A 2023 study published by the American Academy of Dermatology underscores that seniors have significantly reduced sebum production, often by as much as 60% compared to younger individuals, along with thinner epidermal and dermal layers, making them particularly vulnerable to comedogenic, pore-clogging substances like pure castor oil. Within hours of application, undiluted castor oil can obstruct pores, leading to the formation of blackheads, whiteheads, and inflammatory acne, which can persist for weeks or even months in seniors due to their slower cellular turnover rates. The high concentration of ricinoleic acid in pure castor oil, while beneficial in controlled dilutions for its anti-inflammatory and moisturizing properties, becomes a potent irritant when applied undiluted to delicate facial tissue. This irritation can manifest as contact dermatitis, characterized by redness, itching, burning, and painful patches, as well as post-inflammatory hyperpigmentation, which results in dark spots that are notoriously difficult to fade in aging skin. The Mayo Clinic warns that seniors are at an elevated risk for such adverse reactions due to their skin's reduced production of structural proteins like collagen and elastin, which compromises its ability to repair damage. Furthermore, the inflammatory response triggered by pure castor oil can stimulate melanocytes, pigment-producing cells in the skin, to overproduce melanin, leading to hyperpigmentation that becomes increasingly challenging to treat as skin ages. Beverly, a 68-year-old retiree from Seattle, learned this lesson painfully when she applied pure castor oil to her face in an attempt to combat dryness. Within days, she developed severe red patches that persisted for 6 weeks, required dermatological intervention, and left lingering dark spots. Her experience is a cautionary tale for seniors who mistakenly believe that natural products are inherently safe, overlooking the critical importance of concentration and dilution in skincare formulations. The risks of using pure castor oil extend beyond immediate irritation and pore clogging. Prolonged exposure to such a heavy substance can accelerate skin aging by disrupting the skin's natural moisture balance and impairing its ability to repair itself. Mature skin already faces challenges such as decreased hyaluronic acid production, which reduces hydration, and a slower rate of epidermal cell renewal, which diminishes the skin's ability to shed dead cells and regenerate. When pure castor oil creates an occlusive barrier, it interferes with these processes, leading to a dull, congested complexion and an increased likelihood of inflammatory reactions. Additionally, the trapped bacteria and debris under the oil can exacerbate conditions like rosacea or seborrheic dermatitis, which are more common in older adults. To avoid these pitfalls, dermatologists universally recommend diluting castor oil with a lightweight carrier oil, such as jojoba, sweet almond, or grapeseed oil, in a 1:3 ratio, 1 part castor oil to 3 parts carrier oil. Jojoba oil, for instance, closely mimics the skin's natural sebum, making it an ideal choice for seniors, while sweet almond oil provides nourishing vitamins like E and D without overwhelming the skin. Grapeseed oil, with its high linoleic acid content, can help strengthen the skin barrier while reducing inflammation. When preparing a diluted castor oil mixture, ensure thorough blending to achieve a uniform consistency, and apply it sparingly to avoid overloading the skin. A small amount, typically a few drops, is sufficient for the entire face, as excessive application can still lead to congestion, even with dilution. Before incorporating castor oil into your routine, consider consulting a dermatologist, particularly if you have pre-existing skin conditions like eczema or psoriasis, which may require specialized care. By adopting this cautious, diluted approach, seniors can safely harness the moisturizing and anti-inflammatory benefits of castor oil while protecting their delicate facial skin from harm. To safeguard your skin's health and maintain its appearance, always dilute castor oil with a carrier oil before applying it tonight, and monitor your skin's response closely to ensure compatibility. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Mistake 2. Applying castor oil to broken or irritated skin. Using castor oil on cuts, scratches, abrasions, or irritated skin is a dangerous practice that can lead to severe infections, particularly in seniors whose immune systems and skin repair mechanisms are less efficient. The Mayo Clinic explicitly warns that applying castor oil to compromised skin barriers introduces harmful bacteria and significantly delays healing, a concern magnified in older adults due to age-related declines in immune function and wound repair. The thick, occlusive consistency of castor oil creates an anaerobic environment, low in oxygen, over open wounds, providing ideal conditions for the proliferation of pathogenic bacteria, such as Staphylococcus aureus, Pseudomonas aeruginosa, and even Clostridium species, which can lead to serious infections. For seniors, whose skin heals more slowly due to reduced blood flow, diminished nutrient delivery, and slower cellular regeneration, these infections can escalate from minor injuries into significant medical emergencies requiring aggressive treatment. Healthy skin relies on a delicate balance of air circulation, moisture, and immune activity to facilitate healing. But castor oil disrupts this equilibrium by forming a heavy, impermeable barrier over damaged tissue. This barrier traps bacteria, dirt, dead skin cells, and other contaminants directly against open wounds, preventing proper cleansing and aeration, which are critical for recovery. Research from Johns Hopkins Medicine's Department of Dermatology highlights that seniors have compromised immune responses at the skin level, with fewer functional immune cells, such as macrophages and neutrophils, available to combat infections. Additionally, the natural aging process reduces blood flow to the skin by up to 40%, slowing the delivery of oxygen, white blood cells, and essential nutrients like vitamin C and zinc, which are vital for tissue repair. When castor oil is applied to broken skin, it exacerbates these challenges by further impeding the healing process and creating a warm, moist environment that encourages bacterial proliferation. The consequences of applying castor oil to compromised skin can be severe, particularly for seniors with underlying health conditions such as diabetes, peripheral vascular disease, or immunosuppression, which further impair wound healing. For example, Harold, a 72-year-old retiree from Miami, applied castor oil to a small scratch on his arm, believing it would promote healing based on anecdotal advice. Instead, the oil trapped bacteria against the wound, leading to a severe infection that caused significant swelling, pain, and required a 2-week course of antibiotics. The infection left a permanent scar and required follow-up care to prevent recurrence. Harold's experience underscores how a seemingly minor injury can escalate into a major medical issue when castor oil prevents proper wound care, such as regular cleansing with mild soap and water, application of an antiseptic like povidone iodine, and exposure to air to promote drying and scabbing. The Centers for Disease Control and Prevention, CDC, reports that skin infections in seniors, such as cellulitis or abscesses, often progress more rapidly and require more aggressive interventions, including intravenous antibiotics or surgical drainage, compared to similar infections in younger individuals. This is due to age-related declines in immune function, which may fail to contain localized infections, allowing them to spread to deeper tissues or even enter the bloodstream, leading to sepsis, a life-threatening condition. Seniors with comorbidities are particularly vulnerable, as conditions like diabetes impair immune responses and wound healing, while circulatory issues reduce blood flow to affected areas. To prevent such complications, castor oil should only be applied to intact, healthy skin that shows no signs of cuts, scratches, abrasions, redness, or irritation. Before applying any oil-based treatment, carefully inspect your skin under bright, natural lighting, preferably with a magnifying mirror, to ensure there are no compromised areas. If you notice any signs of damage, such as microtears, flaking, or inflammation, refrain from using castor oil until the skin has fully healed. For minor cuts or scratches, adhere to evidence-based wound care protocols. Clean the area gently with lukewarm water and a mild, fragrance-free soap. Apply an over-the-counter antiseptic ointment, such as bacitracin or neomycin, and cover with a sterile adhesive bandage if necessary. Keep the wound dry and exposed to air as much as possible to promote healing, and monitor for signs of infection, such as increased redness, warmth, swelling, or pus. If any of these symptoms appear, seek medical attention promptly, as early intervention is critical in seniors to prevent complications. By taking these precautions, seniors can safely incorporate castor oil into their skincare routine for healthy skin areas while minimizing the risk of infections and other adverse outcomes. To ensure your safety, always inspect your skin thoroughly before each castor oil application, and prioritize proper wound care for any damaged areas. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Mistake 3. Using castor oil without patch testing first. Skipping a patch test before using castor oil is a critical oversight that can result in severe allergic reactions and permanent skin damage, particularly in seniors whose skin is more susceptible to sensitivities and slower to recover. Dermatological studies from Johns Hopkins Medicine reveal that older adults experience higher rates of delayed allergic reactions to substances like castor oil due to age-related changes in the immune system, which becomes less precise and more prone to hyperreactivity. These changes can lead to exaggerated inflammatory responses that are more severe and longer-lasting than in younger individuals, as mature skin has a reduced capacity to repair damage due to lower rates of cell turnover, decreased collagen production, and a thinner epidermal barrier. The natural protective oils in senior skin are also diminished, making it more permeable to potential allergens and increasing the likelihood of developing sensitivities to substances that were previously well tolerated. The inflammatory cascade triggered by an allergic reaction to castor oil can be particularly damaging to aging skin, which lacks the resilience to recover fully from such insults. Research from Stanford Medical School's Department of Dermatology indicates that the skin's immune cells, such as Langerhans cells and T cells, become less discriminating with age, sometimes misidentifying harmless substances as threats and launching an aggressive immune response. This overreaction can lead to severe symptoms, including intense redness, swelling, itching, blistering, and tissue damage, as well as post-inflammatory hyperpigmentation, which manifests as dark spots or patches that are extremely difficult to fade in mature skin. The American Academy of Dermatology emphasizes that these reactions are more consequential in seniors because their skin's regenerative capacity declines significantly after age 60, often resulting in permanent scarring, discoloration, or textural changes that cannot be fully reversed with current treatments. The delayed onset of allergic reactions complicates the identification of castor oil as the culprit, as seniors may use the product for days, weeks, or even months before symptoms emerge. This delay can lead to prolonged exposure, worsening the reaction, and increasing the risk of permanent damage. For instance, Nancy, a 65-year-old from Chicago, applied castor oil to her face without conducting a patch test, hoping to reduce fine lines. After 2 weeks of daily use, she developed permanent dark patches on her cheeks, which required multiple sessions of expensive laser treatments that only partially improved the discoloration. The emotional and financial toll of her experience highlights the importance of a simple, 2-minute patch test, which could have prevented months of distress and significant medical expenses. Nancy's case is not uncommon, as dermatologists frequently see senior patients who overlook patch testing in their eagerness to try natural remedies, unaware of the heightened risks associated with aging skin. To perform a proper patch test, apply a small amount of castor oil, diluted with a carrier oil if intended for facial use, to a discrete area, such as the inside of your wrist, the crook of your elbow, or behind your ear, where the skin is thin and sensitive. Use a clean fingertip or cotton swab to apply a thin layer. Then cover the area with a hypoallergenic adhesive bandage to prevent the oil from rubbing off. Leave the patch undisturbed for 48 hours, avoiding washing or exposing the area to water, and monitor for any signs of adverse reactions, such as redness, itching, swelling, burning, or discoloration. If no symptoms appear after 2 full days, the product is likely safe for broader use, though you should still apply it cautiously and observe your skin's response over time. If any irritation occurs during the patch test, discontinue use immediately and rinse the area thoroughly with lukewarm water and a gentle cleanser. For persistent symptoms, consult a dermatologist to assess the reaction and recommend appropriate treatments, such as topical corticosteroids or antihistamines. The American Academy of Dermatology underscores that patch testing becomes increasingly critical with age, as senior skin's reduced regenerative capacity makes prevention essential for maintaining its health and appearance. Aging melanocytes, the cells responsible for pigment production, can become overactive in response to inflammation, producing excess melanin that results in long-lasting hyperpigmentation. This is particularly problematic in seniors, as the skin's ability to exfoliate and renew itself diminishes, causing pigment to remain visible for months or even years. Additionally, seniors with a history of allergies, eczema, or sensitive skin are at higher risk for adverse reactions and should exercise extra caution when introducing new products. To further minimize risks, consider patch testing any new skincare product, not just castor oil, and maintain a detailed record of your skin's responses to identify patterns of sensitivity over time. By consistently performing a patch test before using castor oil, seniors can avoid severe allergic reactions and protect their delicate skin from irreversible damage. This simple precaution takes minimal time and effort but offers significant protection against the potentially devastating consequences of an allergic reaction. Never skip this critical step. Conduct a patch test today before your next castor oil application, and continue to prioritize prevention to safeguard your skin's health for years to come. Mistake 4. Mixing castor oil with essential oils or harsh ingredients. One of the most perilous mistakes seniors can make when using castor oil is mixing it with essential oils or other potent ingredients. This combination can create a hazardous concoction that poses significant risks to mature skin, which is inherently more fragile due to age-related changes. According to research from the Harvard School of Medicine, combining castor oil with essential oils can result in severe chemical burns, particularly on thin, aging skin that lacks the protective thickness and resilience found in younger tissue. Essential oils are highly concentrated plant extracts, and their potent nature can become caustic when paired with carrier oils like castor oil. The unique chemical composition of castor oil, particularly its high ricinoleic acid content, can amplify the penetration of these harsh substances, driving them deeper into the skin and exacerbating potential damage. Mature skin undergoes significant physiological changes, including a weakened skin barrier, reduced natural moisture, and diminished protective oils. These factors make it less capable of defending against chemical irritants compared to younger skin. Essential oils, such as tea tree, peppermint, or lemon oil, contain volatile compounds that can be irritating even in minimal quantities. When mixed with castor oil, these compounds can trigger a synergistic effect, where the combined harm is greater than the sum of their individual effects. The ricinoleic acid in castor oil acts as a penetration enhancer, allowing essential oils to permeate deeper skin layers, where they can cause inflammation, cellular damage, and even tissue necrosis. The Mayo Clinic has reported that seniors are particularly susceptible to such burns due to their skin's reduced ability to buffer against aggressive substances, increasing the likelihood of lasting harm. The consequences of these mixtures can be immediate and severe, manifesting as intense burning sensations, redness, blistering, and, in extreme cases, permanent scarring. For instance, George, a senior from Denver, experienced second-degree chemical burns after applying a homemade remedy of castor oil mixed with tea tree oil, believing it to be a safe, natural treatment. His skin suffered significant damage, requiring emergency medical intervention and resulting in scars that never fully faded. His case underscores a critical misconception: the assumption that natural ingredients are inherently safe when combined. In reality, the chemical interactions between essential oils and castor oil can produce unpredictable and dangerous outcomes. Chemical burns from such combinations often extend beyond superficial damage, affecting deeper skin layers critical for healing and regeneration. Aging skin has a limited capacity to repair itself, making these injuries particularly problematic for seniors. The resulting scars can be disfiguring, and the risk of secondary infections is heightened if burns are not promptly treated by healthcare professionals. Moreover, the financial burden of medical treatments, including dermatological consultations, medications, and potential surgical interventions, can be substantial. To prevent these risks, seniors should use castor oil in its pure form or combine it only with gentle, time-tested carrier oils such as coconut, jojoba, or olive oil, which have a long history of safe use on sensitive skin. Essential oils, citrus extracts, and other concentrated plant compounds should be strictly avoided, as their interactions with castor oil are unpredictable and potentially harmful. Any existing mixtures containing essential oils should be discarded immediately to eliminate the risk of accidental use. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Mistake 5. Applying too much castor oil too frequently. Another common error seniors make is using castor oil excessively, either by applying it daily or in large quantities. This practice can overwhelm mature skin, disrupting its delicate balance and leading to a cascade of issues that may take weeks or even months to resolve. Research from Stanford Medical Dermatology highlights that overuse of castor oil can interfere with the skin's natural oil production, particularly in older adults whose sebaceous glands are already less active due to aging. Mature skin relies on a precise equilibrium of moisture and sebum to remain healthy, and excessive castor oil application can disrupt this balance, signaling the skin to reduce its already limited natural oil production. This disruption creates a vicious cycle of dependency, where the skin becomes increasingly dry, irritated, and prone to damage when castor oil is not applied. The thick, viscous nature of castor oil exacerbates these issues, as it is slow to absorb and can accumulate on the skin's surface. According to the American Academy of Dermatology, mature skin processes heavy oils more slowly than younger skin, leading to a buildup that can clog pores, attract dirt, and foster bacterial growth. Additionally, the natural exfoliation process slows with age, meaning that dead skin cells and excess oil linger on the surface longer, creating an environment conducive to blackheads, acne, and irritation. Daily application of castor oil compounds these problems by continuously overloading the skin with more oil than it can effectively manage. The aesthetic consequences of overuse are equally concerning. Excessive castor oil can leave the skin looking greasy, uneven, and prematurely aged, undermining the goal of maintaining a polished, healthy appearance. The buildup of unabsorbed oil can also attract environmental pollutants, further compromising skin health. Patricia, a senior from Dallas, learned this lesson firsthand. After using castor oil daily for weeks, she noticed her skin becoming congested and lackluster. Upon reducing her application to twice weekly, she observed remarkable improvements within just 2 weeks, including clearer pores, smoother texture, and a more vibrant, natural glow. Her experience illustrates the principle that, for seniors, less is often more when it comes to castor oil. Overuse can also lead to paradoxically drier skin over time, as the skin's natural oil production diminishes in response to the constant external supply. The Centers for Disease Control and Prevention has noted a rise in skin issues among seniors due to the misuse of topical products, often stemming from a lack of awareness about how aging skin's needs differ from those of younger skin. To avoid these pitfalls, seniors should apply castor oil sparingly, approximately a dime-sized amount for the entire face, 2 to 3 times per week. Before applying, the oil should be warmed between the palms to facilitate even distribution and gentle absorption. Allowing rest days between applications is crucial to preserve the skin's natural balance and prevent overstimulation of the sebaceous glands. Seniors should reassess their castor oil routine and adjust the frequency starting immediately to promote optimal skin health and appearance. That wraps up our deep dive into the 5 dangerous mistakes seniors make with castor oil and how to use it safely for your mature skin. What have you learned so far that surprised you the most? Maybe it's the importance of diluting castor oil, the risks of applying it to broken skin, or the critical need for patch testing. Share one thing you've learned from this video and plan to put into practice in your skincare routine by commenting below. Your story could help another senior avoid these costly mistakes. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more tips to keep your skin healthy and vibrant.